Por Dentro da Imagem, podcast apresentado por Canon Medical.
Welcome to the Por Dentro da Imagem, presented by Canon Medical Systems do Brasil. Today is a special moment. Stay here in JPR event in São Paulo. Thank you very much for watching this video or listening to this podcast. Stay here with the Jessica. Jessica, thank you very much for accepting this invite.
Thank you, Fabio. I'd like to greet the audience that we have in Por Dentro da Imagem. It's a great pleasure for me to be here today by the side of two big references that we have in cardiac imaging. So thank you.
Thank you very much, Jessica. Dr. Gilberto, thank you very much for staying here. This is a special moment for us. The first podcast in English in Brazil.
Thank you very much for inviting me. It's a pleasure.
Dr. Armin, thank you very much for staying here in Brazil. Thank you very much.
Well, thank you, Fabio. Thank you very much for having me. This is very exciting for me. And I thank you for broadcasting this in English. Because if we did it in Portuguese, it would be one-sided.
Dr. Armin, could you please introduce yourself and share a little about your professional background for us?
Sure, it's my pleasure. So yeah, I'm Armin Zadeh. I'm a cardiologist, and I am the director of cardiac CT at the Johns Hopkins Hospital in Baltimore, US. And I'm also a professor of medicine and biomedical engineering there. And I have a career focus on coronary disease. So I am actually not really, strictly speaking, an imager, because I don't use any other tools like echocardiography or nuclear medicine or MRI. Even I really focus on the disease, and I kind of gravitated towards CT coming from the cath labs, and initially it was like more invasively focused, and I embraced CT as the technology of non-invasive evaluation for coronary disease.
Dr. Armin, you are about your important collaboration, the society, by being part of the CORE64 and CORE320. Could you please comment a little bit about these studies and importance? How did you felt by being part of this?
Yeah, thank you. So yeah, I felt very fortunate to be part of the CORE64 and CORE320 multicenter studies. Actually, I was recruited, specifically for participation with the CORE64 study, which was coordinated at Johns Hopkins, and my colleague and mentor John Lima was the principal investigator. And he felt that my background at the time, particularly in intravascular ultrasound, was very suited to be one of the readers of the CORE64 trial. So that was a very special study and involved many prestigious investigators, including right here from Sao Paulo, Dr. Carlos Rochite was one of the main investigators. And I think it's fair to say that CORE64 established in the field the diagnostic accuracy of coronary CT angiography. It was published in New England Journal of Medicine, and I think it was a landmark study. And then subsequently, CORE320 was likewise a multicenter effort, which then focused on what CT myocardial perfusion imaging can add to CT coronary angiography. So there was a even larger effort in terms of sites involved. Again, very strong participation by Brazilian sites, including again Carlos Rochite, but also Dr. Cesar Nomura. At that time, he was at Einstein. He was one of the investigators. Dr. Rodrigo Cerci also was part of the trial. So it was a phenomenal effort, and I think both studies really, I thought, established accuracy. CORE64 coronary CT angiography and CORE320 established the the accuracy of CT myocardial perfusion imaging. So I felt very, very fortunate to be part of these two important studies.
So interesting. Dr. Gilberto, what impacts have you observed in cardiac computer tomography thanks to the multicentric studies?
Fabio, today it seems like everything is, we know how to use it, where to use it, how to understand this kind of information and have it on our clinical way of dealing with the patients. But at that moment, many of those informations were missing. We didn't have it at that time. So if you look during the last 15 or 20 years, this was actually 20 years ago, this was new. We didn't know how to use it or how much we could rely on that. So all of those studies, they paved the knowledge that was developed for us to say, listen, I have something that's good. It can be used. Its sensitivity is in this level. Its specificity the same. So this is the kind of information that we have to use to, when someone asks us, why are you trying to order a cardiac CT, then you can say because of this kind of information that was provided by these multicentric studies. So I think it was very important to have all this information that was built during those efforts.
Perfect.
It's extremely grateful to hear you both talking about the impact that these multicentric studies had in the clinical field. Canon invested many efforts in developing technologies, but the main goal is not only to have the technologies, but also to have the clinical impact. That is the reason why clinical research are so important for us, and having the feedbacks that we are in the right way, it's too important for us. Thank you for giving us your feedback and also for sharing with us your opinion.
Continues in the future, stay in the future now. The computer tomography, what the clinical improvements are being expected in the computer tomography, Dr. Armin?
Well, I really believe that cardiac CT will take over a large portion of cardiac imaging. It is already starting to show that, and because coronary artery imaging, particularly in cardiology, is a huge portion of all our patient population, of our evaluation, and what we ultimately want to look at the disease, which is the atherosclerotic disease, and for the longest time we couldn't do it directly, non-invasively. We just used stress testing as an indirect way to assess the disease, because the only way otherwise would have been cardiac catheterization, invasive imaging, which we know we cannot do in many people. So CT really opened up that opportunity. It opened up the opportunity just to image the coronaries directly, non-invasively, and it really is, I think, creating a major, paradigm change in cardiology. And now that we're seeing all CTs becoming more accurate, having advances in spatial resolution, temporal resolution, so getting faster, more detail oriented, at lower radiation dose, the application becomes wider and wider and wider. So I strongly believe that cardiac CT will largely replace stress testing for the evaluation of coronary heart disease, and eventually I think also be the diagnostic standard for coronary heart disease, period, surpassing invasive angiography as a diagnostic standard. So I think there's a lot of things developing for cardiac CT, and we just have seen just the beginning of it.
And Dr. Gilberto, what do you think about that?
I agree. We want to see more. We want to see better. We want to see more detailed images, and non-invasively. So what we want is to have the kind of quality that at some point the cath lab will be used only for treatment, and so these guys they are busy and they will keep busy but treating people, not doing diagnosis. So that's I think that's the future. That's I think where we are going. Maybe not now, but that's our aim. And I think that with this kind of equipment, we are coming closer to that end.
I have one important question. Could you tell about ultra resolution are contributing to advancement of computer tomography, and how this technology may impact the entire cardiac society once again?
Well, so ultra high resolution CT, means that we have now twice the spatial resolution compared to conventional CT, which is really a quantum leap in my mind. Because again, it's not just a little, but it's twice the spatial resolution compared to what we have been used to, which means that there is greater detail, and detail is that what we want. Particularly in cardiac imaging for coronary evaluation, the plaque is small, and you need great detail to characterize it. There's a lot of interest in high-risk plaque. What kind of plaques cause coronary events, acute coronary death? So detail is needed just to characterize the plaque better, and ultra-high resolution CT is the promise there, and it is very exciting. And I can say that from my experience with ultra-high resolution CT, that we indeed get more and more detailed information about coronary atherosclerotic disease, and we're just starting to kind of like understand what that means for diagnosis and therapy. Again, we're just like at the very beginning, but I think this is very fascinating.
And Dr. Gilberto, what do you think?
Well, considering the whole society, imagine having people, instead of going to the cath lab, going to the CT. Personally, myself, I would prefer to go to the CT if it was not necessary to have treatment. So it would be cheaper, easier, and it would be faster. So I think for the whole society, we are moving the diagnosis to something that's simpler to do, to perform. And I think this is a huge impact.
Perfect. Jessica, could you bring more details about your important technology advancement in computer CT and computer tomography?
For sure. We from Canon have a product launched in the purpose that Dr. Armin and Dr. Gilberto just explained, that is focused in high resolution. It's a Achillean precision, and with this equipment we can achieve a much higher resolution than it used to be in computed tomography. Now we are talking about getting much more detail in the images. We have 0.25 millimeters slice thickness in the CT, and with that we can see much more from the images. And this is one point of the development in the technology, but we also have it bring to the volumetric CT. We have improved in resolution in volumetric CT due to the technologies related to the deep learning. So now we have PIC also improving the resolution in volumetric CTs to combine these both worlds, the high resolution that they have in Achillean precision, and also to keep the 1-bit acquisitions. So Canon strongly believe that the correct way to continue the developments are related to the ultra-high resolution.
Technology is amazing, and Brazil is amazing too. Dr. Armin, this is the first time here in Brazil. What are your expectations regarding a JPR event, Jornada Paulista de Radiologia, and your visit to the country in Brazil?
Well, yes, thank you. It is actually my first visit to Brazil, and I'm very excited about it. I, obviously have a lot of, expectations. I read a lot of about the country, and I have so many Brazilian friends who tell me about it. So it's really nice to see it in person. I just arrived today, so I'm looking forward, to get a lot more experience over the next few days. One thing I can already say is what I love about Brazil is its diversity. I think it's really fascinating and beautiful to see, all these different influences from people all over the world in one country, where people don't care, whether what your color of your skin is, or what your features are, what your background is. You're all Brazilians, you're all in this country, and everybody's excited about football and and a good life. I mean, in the US, you have diversity too, but in Brazil, it seems like it's another level of diversity, which is really beautiful to see. So I'm very excited to be here, and I'm very thankful for the opportunity. And the JPR is the biggest imaging meeting in South America. So it's very impressive, and I'm very much looking forward to see more. Today I just got a glimpse of the exhibition hall, which is beautiful, and so yes, I'm very excited to see more of the JPR, and looking forward to listen to many presentations. Thank you.
Oh, thank you very much. The time flies here in the Por Dentro da Imagem. And I would like to ask in the last question, thank you very much, leave the final message to the podcast spectators, please, Dr. Armin and Dr. Gilberto and Jessica, please.
I go first.
Yes, please.
So the message is cardiac CT is here to stay, and it's going to expand rapidly. This is a fantastic time to be part of the cardiac CT community. It really is. It is taking over in a large portion of cardiovascular imaging, and will continue to do so. So this is a great time to be engaged and to be excited about what's happening in terms of advancing this technology and clinical application. So you be involved.
Doctor?
Well, I think we all have high expectations regarding this equipment. I think our expectations are related to the ability of overcoming some of the obstacles that we had before and being able to see through more calcium, for example. So I agree with Armin. We are living a very interesting time, and it's very good to be part of this community. So this is the beginning of something new for us.
Thank you, Doctor.
And it's great to see how motivated you both are and keep doing things different from what they are doing now. So I'm pretty sure that you both, together with the community that you work in it, will keep developing a lot of things and bringing more usability for the computed tomography due to the use of ultra-high resolution. And I'm extremely glad of having you both as partners of us. And thank you for your participation.
Thank you.
It was incredible conversation. Thank you very much for listening and watching this podcast Por Dentro da Imagem, presented by Canon Medical System Brazil. And send one email to contato @pordentrodaimagem.com, and see you next week or next time, everyone. Thank you for listening and stay tuned for Por Dentro da Imagem. Thank you.